Hello, everyone, and welcome to our very first episode of this year's Open House Self-Care Edition. Today, we are going to be talking about optimizing wellness through weight loss and hormone balance. My name is Maite Ornelas. I am a physician assistant here at Nowak Aesthetics. Of course, you guys know Dr. Eugene J. Nowak, who is our board-certified dermatologist, and the beautiful Corinne Case, who is our physician assistant. Like I mentioned, we're going to be talking all things weight loss, specifically diving into semaglutide, how we use it as a tool to lose weight. And then, of course, if we're having other symptoms that are maybe signaling that we need to optimize our hormones as well. So if you haven't heard about us or you're new to our practice, we are Nowak Aesthetics. As I mentioned, Dr. Eugene Nowak is our founder, and we've been here in Chula Vista for over 25 years now. We specialize in all things non-invasive aesthetic treatments, things like Botox, fillers, lasers, and then we're also experts in body sculpting and wellness. Fun little fact, we are a family-owned business, so once you come in through that door, I hope that you feel that, and we can't wait to welcome you. Let's get right into weight loss. And like I mentioned, we're going to talk about semaglutide, but let's talk about why we gain weight. So I think the most obvious thing is going to be diet and exercise, what we're eating, how our activity level is. Of course, stress is going to be a major impact as well that sometimes we don't think about. But if you are going through a very stressful moment in your life, this can definitely impact your weight. It can impact your sleep. Sleep is going to be another thing that can make us gain more weight if we're not getting adequate amounts of sleep. Of course, our age is something that we can't necessarily control, but through lifestyle, we can delay some of these things that we see with aging. Now, as we age, it's harder for us to retain muscle mass. Our hormones are changing. Our metabolism is slowing down. And so definitely we're seeing those changes in our weight. And then, of course, things like genetics, medical conditions, and medications are other things to consider, reasons why we would be gaining weight, although some of these are a little bit harder to deal with just because they can predispose you to either being more hungry, having slower metabolism, and therefore gaining weight. Now, semaglutide, maybe many of you guys have heard of this, or maybe you guys have heard of Ozempic or Wegovy or, Mounjaro, Zepbound. Those are all different forms of GLP-1s, which we will talk about here. I like to describe semaglutide as a peptide that mimics the hormone glucagon-like peptide 1. Very big word for GLP-1, which probably you've heard of, thrown out there. But essentially what is happening is that this is a hormone that normally is released when we are eating and therefore signaling to our body that we are full and we're not eating anymore. And that's why it was FDA approved for type 1 diabetes and now officially has that weight loss indication. Again, the brand name is going to be Ozempic, Wegovy versus versus something like tirzepatide, which also works at the GLP-1 receptor, but also works with another receptor called GIP. And so we can talk about which one you would be a better candidate for at your consultation. But they are both once weekly injections. And so as I was saying here, we can see all the different areas that this medication works on. As far as the brain level, it's probably going to be the biggest impact because you are, once again, getting that signal to your brain that you are not hungry anymore. If you're serving yourself a giant portion size that you could normally eat, you'll start to realize that you can only maybe eat half of it or a small portion of that, and you won't feel the need to continue to eat, which is great. As far as the GI tract, the stomach, it delays gastric emptying, it slows down your GI tract. That food is sitting there a little bit longer, and so you're feeling fuller for a longer period of time. And then it has other benefits for like insulin sensitivity, which relates to the diabetes, and then of course cardioprotective. So it's helping your heart health. Now, the most common side effect that we see here, of course, is going to be what we want, which is weight loss. And we have seen a ton of success with our patients. With that comes happiness. As I mentioned, you are feeling full. You're not getting those cravings, that food noise where maybe you've had your full meal and then, it's late at night, you want something sweet, you want something salty. And so there you go. You go and have some more. And so this is essentially how you are going to lose weight, is by cutting out all those calories that those calories that you're no longer consuming, being in a calorie deficit, and then actually being able to burn some of that fat. Now, nausea is something that we see primarily the day of injection, if anything at all. Usually doesn't linger for very long, but it can be a little bit noticeable. Constipation more so than diarrhea, simply because we are slowing that GI tract down. And so the constipation, if we're not drinking enough water, if we're not eating enough fiber, you might notice that. Diarrhea, not so much, but that's going to be when you have fatty or sugary foods, greasy foods. Your body will tell you, hey, I don't want you eating this while you're having semaglutide. And then, of course, heartburn and a little bit of fatigue that we combat with supplementing with vitamin B12. So who are we looking for when we are talking here in Noack Aesthetics as far as a good candidate? So we're looking for anybody that is looking for a healthy weight loss solution, that you're wanting to lose weight gradually. So it's not an overnight thing. Over a period of a week, you're not going to lose 20 pounds. We want to do it in a very, very healthy way. We want to make sure that we are retaining your muscle, that we are not just burning through that muscle mass. Like the studies, 40% of that weight that was lost was muscle. And usually it's because you're not eating enough. So we really like to emphasize that we want to retain your muscle. We also like to work with people that are overall healthy. If you have a lot of medical conditions, the best solution for you is going to be to go through your primary care or your specialist, whoever is managing your health. And then more importantly, we want to make sure that you're ready to make some lifestyle changes, because again, semaglutide is not going to actually burn your fat. It's just a tool to get you to eat less calories in a day so that you can be in a calorie deficit and therefore see that weight shed right off. Now, when we brought this to Noack Aesthetics, we were thinking about all of the different options that are out there. We know that you can get it online. We know that you can go to a lot of different places, but we want to make sure that we are committed to what we call comprehensive weight loss. So what that means is that you actually get to meet with us as providers. We're managing this treatment for you. We're making sure we're answering questions if you're having symptoms, adjusting doses, things of that sort. We also have a tool called our InBody scale, which is going to show us the composition, so the difference between your skeletal muscle mass versus your fat mass. So we're actually going to see, are you truly losing fat or are we losing muscle? And if so, what do we need to do? What changes do we need to make in order for you to make sure that we are focusing on that fat loss? We're also implementing vitamin supplementation, and based on where our consult takes us, we may be doing blood work analysis, looking at your hormones, looking at those levels to make sure that your body is at an optimized place to lose weight. And then we have things like Emsculpt, right? So Emsculpt can help build muscle if you're really wanting to build a nice pair of abs there, or arms, or whatever area of the body that you're looking to build muscle for. And then of course, tightening skin. We have procedures that if you're looking to lose substantial amount of volume, it's inevitable you're going to have a little bit of skin laxity. So we have different procedures to help combat those changes that we see with our skin as we lose big volumes of weight. And then if you've been to Noack Aesthetics, you know we love membership programs here that make it really easy for you to just come on in once weekly for your injection, make sure you're getting the best price, make sure you're getting everything that you need, your vitamins, your InBody scale, all of the good stuff that we just throw into our memberships. Now, here is the InBody scan, which I was mentioning. So you're able to access this through your phone. There is an app that at any point you come in here, it's tracking your progress. So you can see your muscle mass, your body fat, your visceral fat, your weight distribution, your basal metabolic rate. All of these things will be tracked right on your phone. At your consult, we'll also talk about these lifestyle changes that I was mentioning, which are going to include some degree of calorie counting or having a concept of what you're consuming in a daily basis, because at the end of the day, this is what's going to give you that success. So we will go over what kind of protein, carbs, fat, all the different macros that you need to consume based on your weight, your basal metabolic rate, your activity level. All of those things will be covered at your consultation. And then here are a few success stories from our patients, which we see every single day. Over a period of 6 months, he was able to lose 30 pounds. You can see that he really dropped down on his visceral fat, which is the fat that surrounds our organs that we want to get rid of. And he's looking and fitting so much better in his shirt. We have another patient over a period of 6 months losing 46 pounds. 3 levels of visceral fat. And mind you, these patients are not losing their muscle, which is unbelievable. And one more patient here who over 4 months was able to reach her goals. She lost 27 pounds. And you can see that overall, she's just looking and fitting into her clothes so much better, feeling better, more energy, more motivated, more confident. So a lot of really good success here. Now, let's say you've kind of done this on your own. You're eating well, you're exercising, you feel like you're doing all the right things, but you are not losing weight. Do any of these other symptoms sound familiar to you? Maybe you are super tired, you're fatigued, but you still can't sleep at night. Maybe you are definitely gaining weight. You have brain fog, reduced mental focus, decreased sex drive. If you're female, maybe some hot flashes, some night sweats, anxiety, irritability. So if any of these are like, yes, I absolutely do feel any of these or most of these, then maybe it's time to look at your hormones. And so here we do bioidentical hormone replacement therapy, which is essentially the opposite of synthetic, meaning that the hormones that we use are the exact same molecular structure as what our body produces. And so it's going to limit any side effects. It's going to help boost your testosterone, your estrogen, your thyroid are the things that we look at. And then we also have nutraceuticals that help keep that hormone balance. So testosterone, usually we think of males, and yes, males do have a lot of testosterone, but as females, we also have a good amount of testosterone, and more than estrogen, more than progesterone. So it's a very important hormone for us, both women and men. So with testosterone, you see increased energy. It helps with depression and anxiety. You have more clarity. You have better memory, so that brain fog starts to diminish. You can actually build bone with testosterone as well as muscle, which is beautiful for women because we know we're more prone to osteoporosis. It helps burn more fat and it increases your sex drive. Now, estrogen is going to be a little bit more of our female hormone, but it helps with those hot flashes that we're feeling. Maybe you wake up in the middle of the night and you're sweating. It helps maintain collagen in our skin. So we start to kind of get... a lot of women describe it as pruny, right? Because we're not having that moisture in our skin. We're feeling dry, and it's not just our face, it's our entire body, maybe even vaginal dryness. So this estrogen helps relieve that. It also helps us be a little bit more happy. Helps maintain our bone density, our bone strength, also helps with memory, and it lowers cholesterol and increases HDL. So a lot of overlap here, but definitely things that as we continue to age, we notice, hey, I don't feel like myself anymore. And so that's exactly where the bioidentical hormone pellets come in. Now, there's different ways of administering hormones. Maybe you've heard of pills, or maybe you've heard of creams, patches, lots of injections, lots of different ways of administering. Here we like to use pellets, and you can see here how tiny they are, but they're essentially being applied in the little fat pad layer right over the glute muscle, where they're going to pick up build a blood supply to that area, and that's going to simulate as closely as possible the way that our hormones naturally are released. So instead of having a peak of hormone when you take maybe a pill or a shot and then dropping and feeling horrible once all of that is gone, this is actually going to be based on your cardiac output, so how active you are, right? So it's going to be steady levels of hormone in your bloodstream. They are natural derived, they're plant derived compounds. And for women, we're doing around 3 months. For men, we're doing it around 6 months. And it is the most studied form of bioidentical hormone replacement therapy. So it's an excellent choice. We absolutely love it. And again, we've had great success over these years. Now, here is what it looks like. I know it looks scary, but out of all the things I do here, I say that this is probably the least intense thing or painful thing or comfortable thing for you guys. The pellets are super tiny. We don't even have to stitch anything up. We just put a nice little steri strip over it, a little bandage, and call it a day. You'll see that we'll talk about the next 3 days for women, 7 days for men. You're going to have a little bit of recovery or things that you want to limit, like exercise, just because we don't want to work that pellet out to the exterior point. But basically, you get to relax for that time period. And then we follow up with you in 6 weeks. So at that point, you should be feeling some symptom relief. And then at 10 weeks is when we'll do your actual blood work. That's going to be about 2 weeks before your next insertion if you're a female. If you're a male, we're going to wait out till the 6 months. But it's going to give us what what your body has worked through in that 3-month period, and then help us adjust your dose for the next treatment. So we're also going to be doing annual labs. At that point, we want to make sure that everything is doing well, that if we do need to adjust dose moving forward, that we do. And then we also have a membership for this as well, which is called our Beauty Within for our women, and then Strength Within for our male patients. So we have lots of options. Now, if you are thinking, what else can I do? We talked about pretty much all of these things here. Semaglutide and hormones pair really beautifully together. Emsculpt, we kind of touched base on. Here is our beautiful Diana doing Emsculpt on one of our patients, which you can do on the abdomen, arms, the thighs, all over the body, the booty as well. There's things like cool sculpting too. If you're like, I'm losing weight, but maybe there's a stubborn pocket in my abdomen. Cool sculpting is an excellent treatment to help spot treat those areas. And then if you're like, you know what, I want something faster that I'm going to see very quickly and target the areas that I'm looking for, then maybe Awake Lipo is right for you. But we will be able to do a free consultation because you are watching this video here. And so we are going to go ahead and go into our live Q&A now. Because you attended, you get, like I said, a free consultation. And then these are going to be our next episodes that we are talking about every Wednesday at noon. Next week is going to be about our face treatments, then it'll be body, and then we'll kind of go over everything again. So stay tuned. Right now, we are going to do a live Q&A, and we'll be sure to answer all of your questions.
Amazing job there, sharing the information, things that we have so much fun doing every single day. We get to make people happy. We get to make people feel better, look better. And so it's so great that we're able to share this with all the people that have joined. So now we're going to have some questions. I know some people have already sent some questions in. If you have a question, go ahead and put it in the chat, and we'll go ahead and get started.
Yeah. Okay. So first question. Will I lose my hair while taking semaglutide? And if so, how can I prevent it?
Yeah, so a great question there. So what we are doing, we're doing several things to give you the best results with the least amount of side effects. And that's anywhere from, using the medication in a stepwise dosing fashion, making sure that you are getting the right nutritional components there, and trying to lose weight in a healthy, sustainable way. Okay. And so I had a patient come to me. She was being treated somewhere else. She was losing 15 pounds a month, and they were going to double the dose on her medicine. Okay. 15 pounds a month is not sustainable. She's losing muscle and she's depleting her body, and she's at a high risk of losing hair. So our patients were looking for 4 to 5 pounds in a month where we're sustainable. We're going to protect the muscle, protect the hair. We have great products like Nutrafol. If you haven't heard it, it's a nutritional supplement that's designed and shown to help people to grow and maintain hairs. So that's a great tool for us. We also have like PRP treatments and lasers. So if you're already on the thin side with hairs, we have ways to boost that up for you and to protect those hairs.
Great. Okay, questions are flowing in. So who is the right candidate for hormone treatments?
I'll take it. So pretty much if you experience any of those symptoms that we kind of just talked about, as far as, you're feeling tired, lack of energy, brain fog, you're maybe gaining weight, all of these things that sometimes we attribute to just life. It's possible that your hormones are not where they're supposed to be or where they once were when you felt at your best. So if you are experiencing any of those symptoms, the best thing to do is come on in. We'll go over them. We'll get a few blood work analysis to check what's reading on your labs. And then from there, we have a better idea if you're a good candidate for it. But we always start with your symptoms, and then we go from there.
Great. Okay, so how long do I have to be on pellets for?
Okay. All right. So as Maite was saying, it's one, checking your levels, then optimizing those levels. We want to see where the level is best for you. And so it's all about seeing how you've responded to the treatment and how you're feeling. The pellets will last 3 to 4 months for a female, 4 to 6 months for a male patient, because they're getting a few more pellets in there. Now, if you love what this is doing for you, because it's going to have a lot of benefits, anywhere from protecting your muscle, building muscle, increasing bone density, clearing the brain fog. People tell me if they don't feel like going to the gym, or they're at the gym, they don't feel like staying at the gym, they're going to check their calendar because it's probably time to look at getting their pellets boosted. So if you love the benefits of it, then you want to look at that membership to help you keep on it. If you say it wasn't the right balance for me, and I think it's like the company says 95% of the people, we can find a good balance. So there's probably 5% that say, I didn't feel as much boost. We have a few people say that was too much of a boost for me. So, but 95% of the patients love what we're doing with that and want to keep feeling good. So as long as you want to keep feeling good, keep on the pellets.
Yes. Great. Oh, here's a good question. Can I drink alcohol while using semaglutide or tirzepatide, and how am I going to feel about it?
Well, the answer to this is maybe, but we definitely are going to probably drink less alcohol than we did before. So there's people that use these medications, need a very low dose, don't have a lot of side effects or symptoms. It would be normal the day you receive your medicine to feel a little queasy or a little bit of nausea would be okay. If we're feeling that every single day, we need to either adjust your medication, adjust the dosing on it. So alcohol, clear alcohols tend to be, like vodka, tends to be better tolerated than like a sugary, pina colada drink or something like that. So something that's too sweet might upset your stomach, might bring on some side effects there. And people just say that, one, they just don't feel like drinking as much as they used to. And that's part of it, because for a lot of people, those are empty calories. So there's every shot, even a vodka is like 100 calories per shot there. So
that's crazy. And it's true. I feel like a lot of patients, even for the ones that had that question to begin with, and have a really social life that involves drinking, a lot of them have noticed that they're just not needing to either drink as much or at all. So your desire for alcohol will change slightly with that as well.
Sure. But most people are able to socially have a drink and still enjoy it.
Exactly.
But the really super sweet things, if that's your jam, you might want to be careful with that one.
All right. Great question. So here's the next one. Is it safe to be on semaglutide if I have thyroid issues or PCOS?
So this is where the blood work comes in, to get into medical history to see exactly what's going on with the thyroid. There's very few absolute contraindications to taking the medication. If someone has like a family history or a history of thyroid cancer, particularly the medullary thyroid cancer, that is like a definite no for that. Now, if you're having trouble with your thyroid, this is where, we may need to look at optimizing it. We had a patient that had like the thyroid antibodies. And so we recommend like a low inflammation diet or gluten-free diet. And that was enough to kickstart her thyroid. And she lost some weight very quickly because that's what was throwing her out of balance. So that's part of getting that blood work, that blood analysis, and sitting down with you and seeing where the opportunities are to help you feel better.
Good question. Okay, they're still flowing in. Keep asking your questions. There's a little chat box that you can participate in, or even if you click the Q&A, it's a great place and we'll be happy to answer your questions. Okay, so if I stop taking semaglutide or tirzepatide, will I gain all the weight back? And how can I maintain my results?
That's a good question. I think a lot of people, if they've had this done before and suddenly stopped, have found that maybe they did have a little bit of a rebound as far as just gaining some weight back. But I think part of what we try to emphasize is as you are losing your weight, building new habits that are going to help you maintain that weight loss, because the hard part is being in a calorie deficit and losing weight. Once you have reached your goal, it's a lot easier to maintain that weight than to always be in that calorie deficit. So we try to build new habits. We are constantly, talking to you on a weekly basis as far as what those look like for you, what you're eating, what food choices you're making. And then also too, our goal is to slowly kind of taper you off of the medication, where it could be, depending on the dose that you get up to, it might mean, just extending the time between injections from 7 days to 10 days to 14 and so on and so forth. And then you have the opportunity to use a maintenance dose too. Maybe that's every 3 weeks for you. Maybe that's every 4 weeks for you. A lot of patients really, really love that because they see a lot of other benefits than just weight loss. They feel like they have, less inflammation. And so there's a lot of other things I think that patients have realized, hey, I want to continue. And so we have options with that, especially with our membership. And we'll talk about that with you. It's different for everyone. It's not the same, but we do definitely address that. So we make sure that you're not feeling like you've just, lost all your hard work.
Yeah, no, we don't want you to lose any of those benefits there. And I kind of break it into two categories. You have the people that have the food cravings, the food noises, and you have the people that just don't feel full. And so when we're using the medicine, it cuts down the cravings. It helps us to feel full. We like the word lifestyle. If we can give you a lifestyle and you can adapt to it and you say, I like this and I can maintain it, you're going to maintain the results. And if you suffer from those cravings, those urges, that food noise, you might need, or you might benefit and might feel more comfortable having just a little bit of that medication to help keep you in better balance there.
Yeah.
Okay. Can I do hormone therapy and semaglutide at the same time?
They really, really work great together. Okay. Because with the semaglutide, we want you to do activity and exercise minimum of 3 days a week because you want to protect your muscles. Your muscles are like a furnace helping us to burn through the calories, helping to get you into better balance. Now, if we don't have testosterone, and traditional medicine isn't big on giving women back testosterone, they give it to men. And the more I read about it, I don't know why we don't give it back to women, because anywhere from the cardiac heart benefits to the increased bone density to building that muscle mass. So with testosterone, you could build more muscle sitting in that chair with testosterone than going 6 days a week to the gym with no testosterone. So there's a lot of benefits. So it's only going to kind of accentuate or optimize both sides of things. So if we don't have the muscles to burn that off, we don't have the energy and drive to work out the way we used to, we can still lose, but it's going to be a lot harder.
Okay. Thank you, Dr. Nowak. So that is the last question. So thank you everyone for watching our self-care open house wellness virtual event. Yay. So just for attending and watching today, you will get a complimentary consultation, which is valued at $100. And you get to meet with our experts to talk about your goals, and we're going to help you to get there. So you may have already received it, or you will be receiving a text message shortly. So make sure you reply yes to claim that free consultation, and we are going to reach out to you as soon as possible. Remember, this is only valid until the end of the month. And we're booking up fast. So please reply yes as soon as possible, and then we'll get back to you.
Yeah, so thank you, Angel. This is our open house time of the year. So we have some amazing specials and promotions. We team up with the manufacturers. So there's things that happen this time of the year that don't, anywhere from discounts on products to procedures. You know, we're going to be covering over the next couple sessions some of those options or opportunities there. And we can solve a lot here virtually with things like this. But if you have specific questions or concerns, let's get you in for the consultation and let us learn about you and what we can do to help you. So thank you so much for joining us today. Thank you, Maite.
Thank you.
Thank you, Angel.
Yeah.
Thank you. Okay, we can't wait to see you soon.
Okay,
Bye-bye.
bye.